The third group diuretics that we will be discussing today is loop diuretics. Unlike thiazides, loop diuretics are known as the high-ceiling diuretics. Increasing the dosage of a loop diuretic will increase its diuresis effect. After this lecture, I wish to accomplish the following objectives. Among all diuretics, medications working on the ascending loop of Henle are most effective in moving sodium and chloride. Therefore, they are the most powerful diuretics, which is the loop diuretics. Under normal physiological function, sodium, potassium, and chloride are actively reabsorbed into the blood via sodium-potassium chloride cotransporter and secondary transport pump on the luminal membrane. Magnesium and calcium, on the other hand, are removed from the luminal filtrate through paracellular route into interstitial fluid. Loop diuretics affect the cotransporter. Loop diuretics are the most powerful diuretics because they take effects on the ascending loop of Henle. Normally, in ascending loop of Henle, 25 to 30% of sodium in the filtrate are reabsorbed back into the blood via the sodium-potassium chloride cotransporter. Medications in the family of loop diuretics inhibit the sodium-potassium chloride cotransporter, decreasing reabsorption of these three cations. Therefore, loop diuretics promote excretion of sodium, potassium, and chloride into urine, resulting in high osmolarity of the filtrate. The urine with increased osmolarity continues its journey to lower lumen and attracts fluid into the urine, producing diuresis. Blood pressure is then decreased as the preload is decreased. The loop diuretics are prompt and potent. It works well even on patients who do not respond to other diuretics or have renal failure. Although loop diuretics increase calcium in urine, hypocalcemia is unlikely to occur on patients who has normal serum calcium, as calcium is reabsorbed in distal tubule. Loop diuretics can increase blood flow by promoting prostaglandin synthesis. Medications that interfere with renal prostaglandin synthesis will decrease the diuretic effects. Therapeutically, loop diuretics belong to the category of antihypertensives as well as diuretics. Medication pertain to loop diuretics are furosemide, bumetanide, torsemide, and ethacranic acid. Among all adverse effects, we are going to focus on these 5 symptoms: autotoxicity, hypererixemia, acute hypovolemia, potassium depletion, and magnesium loss. Autotoxicity. Loop diuretics can cause reversible or permanent hearing loss. The risk of hearing impairment increases, especially when using loop diuretics with other medication that is autotoxic. Many medications have autotoxic property, including aminoglycoside, salicylates, NSAIDs, quinine, etc. Ethacranic acid is highly associated with deafness. Vertigo is a manifestation of autotoxicity as vestibular function is affected. Hypererixemia. When furosemide and ethacranic acid act on renal ascending loop of Henle, they compete with uric acid for renal secretion. Thus, excretion of uric acid is blocked, which means serum uric acid is increased, resulting in more incidents of exacerbation of gout. Acute hypovolemia. Being the most effective diuretic, loop diuretics create prompt diuresis, which can lead to acute hypovolemia. Possible shock is resulted, and risk of cardiac dysrhythmias increases. Potassium depletion. Increasing sodium concentration in luminal fluid means increasing exchange of tubular sodium and potassium. Hypokalemia results. Loss of intracellular potassium promotes exchange of hydrogen. Subsequently, alkalosis, or more specific, hypokalemic alkalosis results. Magnesium loss. Hypomagnesemia can be resulted with long-term use of loop diuretics. This adverse effect affects elderly more. Teach patients the signs and symptoms of adverse effects, as well as management of these side effects. Patients should report to the physician if experiencing any adverse effect. Given to their hypotensive effect, monitoring blood pressure and heart rate prior to administering medication is recommended. Teach the client on safety precautions and orthostatic hypotension and safety measures to avoid complications caused by adverse effect on central nervous system. To avoid GI adverse effect, administer medications with food. Nursing care for hearing loss includes monitoring auditory function and precautions in medication administration. For electrolyte imbalances, nursing care includes monitoring electrolyte status, especially for elderly patients, and providing potassium supplements as prescribed. Monitor effects of concomitant medication used. For some medications could either add to or decrease the effects of loop diuretics. Teach the patient to call 911 when experiencing chest pain, shortness of breath, and difficulty breathing, as these symptoms may indicate shock reaction resulting from acute hypovolemia. Loop diuretics are used for edema. It is a choice of drug for treating pulmonary edema. Especially during emergency cases, IV loop diuretic is most effective. Loop diuretics are also helpful in treating peripheral edema caused by heart failure and renal impairment. Electrolyte imbalances are indications for loop diuretics. For example, these medications stimulate excretion of calcium. Therefore, they are used for hypercalcemia. Loop diuretics can also be used for hyperkalemia. Autotoxicity is a major concern when using loop diuretics. Risk of autotoxicity is associated with rapid injection of IV furosemide, using a loop diuretic in combination with other autotoxic medications, using a higher than recommended dosage of a loop diuretic, and using a loop diuretic on patients with severe renal impairment. Therefore, these practices and conditions are contraindicated for using loop diuretics. Other contraindications are anuria and hypersensitivity to the medication. There is no well-established data to support usage or not during pregnancy. Therefore, administering loop diuretics in expectant mother only if benefit outweighs risk to fetus. Loop diuretic may appear in breast milk, used with caution during breastfeeding. Weigh benefit and risk for justification of usage during breastfeeding. When using furosemide in premature newborn during the first weeks of life, there is an increased risk for persistent patent ductus arteriosus. To avoid risk of autotoxicity is a major focus for nursing care when using loop diuretics. The nurses should collect thorough medical history, rule out risk factors of autotoxicity and drug allergies. In addition, the patient should be taught to report to the physician when pregnant or wish to breastfeed. It is understandable that risk of hypotension is increased when loop diuretics are used in combination with other antihypertensives or medications suppressing central nervous system. Risk of acute hypovolemia is increased when using a loop diuretic with other diuretics. NSAIDs affect synthesis of renal prostaglandin. Therefore, diuretic effect of a loop diuretic is decreased if used with NSAIDs. Using medication with other autotoxic medications increases risk of autotoxicity, such as temporary or permanent death or vertigo. Loop diuretics can decrease excretion of digoxin and lithium, leading to increased risk for toxicity of these two medications. Make a list of medications that patients are currently taking is always recommended. Monitor blood pressure and heart rate, especially when using combination therapy for treating hypertension. Monitor diuresis, electrolyte, and fluid status. Know that elderly patients are more susceptible to hypovolemia and electrolyte imbalances. Avoid using loop diuretics with other medications that are autotoxic. Monitor digoxin or lithium levels. Aloe vera can increase diuresis of loop diuretics. Licorice can worsen hypertension, decreasing effect of loop diuretics. Any food can decrease absorption of medication. Mild sun exposure as a loop diuretic has a photosensitivity effect. Instruct the patient to avoid taking loop diuretics with aloe vera and licorice. Instruct the client to wear sunscreen or long-sleeved shirt to avoid photosensitivity. Diuretics should be taken during daytime, first dose in early morning and second dose in early afternoon to prevent nocturia. The 2 doses should be taken apart with a minimal 6-hour interval. Loop diuretics can be administered via oral or intravenous route. When giving IV, it is important that we know the following. IV medication should be clear and colorless. After IV solution is prepared, use it within 24 hours. When giving an IV push, administer it over 1 to 2 minutes. To avoid autotoxicity, IV infusion should be given at a rate slower than 4 mg per minute. Do not mix loop diuretic IV solution with acid solutions, amiranon, miranon, and ciprofloxacin. Administer IV loop diuretics apart from other IV fluid with saline flush and using a separate set of tubing. Loop diuretics have a prompt action, which means predictable diuretic effect. Their duration of action is relatively short, about 2 to 4 hours. Furosemide is the most commonly used loop diuretic. Both bumetanide and torsemide are much more potent. Ethacranic acid is not used much in clinical practice because of its severe adverse effect of deafness. Thank you for taking this lecture with me. I look forward to seeing you again.